All right. Welcome, Caroline, and welcome everyone to another episode of Sex in the Bull City. I am Dr. Sophia Dorton Caudle, and this is Caroline Rutledge, and we are super happy to be here to talk with y'all today. Just for a few minutes, we are going to share with y'all about a new area of work that we're adding here to Bull City Psychotherapy, also to our new practice in Charlotte, Queen City, Sex and Relationships. So we're going to be talking today about sex addiction and eating disorders and how those two addictions occur at the same time in a lot of people. So this is a new area that we're going to be specializing in, that we already specialize in, but we just have a lot of new offerings besides individual and group therapy that we want to just be talking about today. But first, we want to just come together and just share a little bit about why sex addiction and eating disorders are important and why they show up together, how they look, how it presents, and hopefully finding a way for you to be able to even find something that you can relate to, or like, oh well, maybe that happens to me and I just didn't realize it, or to my child, or to my partner, or maybe a friend. But this is a real area that we're really hoping to tap into. There's a lot of need here, and not a lot of people that I'm aware of specialize in it. So we want to really come together with you and provide the services that are important in this space. So I am a CSAT and CSAT supervisor. I've been working in the field of sex addiction and sex therapy for a lot of years now. Caroline is getting trained in sex addiction, and she is an eating disorder specialist. So together, she and I are creating a larger program that we're hoping to really be able to have a lot of online presence, workshops, intensives for people all over the world, and also some in-person retreats here in North Carolina, and other places too, if that's how it works out. But yeah, before we get too far into anything, I just want Caroline to say hi and tell us a little bit about what this eating disorder specialist certification, what that is, and maybe what that means to her.
Yeah, awesome. Good to be here. And it's actually been quite a while since I've been on a podcast, so I'm super excited. And I have really just in this past year transitioned to Bull City Psychotherapy full time after working in higher levels of care for eating disorders. So it's exciting to be at the outpatient level and to just kind of bring some awareness to this kind of niche that we're specializing in here at Bull City Psychotherapy. But yeah, I've it's been my graduate school training was in eating disorders, and I'm now in the process of becoming a certified eating disorder specialist through the International Association of Eating Disorder Professionals, and am connected with some nonprofits here in North Carolina helping provide access to care for eating disorders in particular. But yeah, I have had my own personal struggles with eating disorder when I was in college and post-college, and fully believe recovery is possible, and really love working with the eating disorder population, and now too with sex addiction. And I'll never forget, early on after I finished grad school, I was leading a group at a residential treatment setting, and I was just doing a general addictions group there. And we were, this was an eating disorder treatment facility, but we were talking about addictions and stages of change. And I mentioned sex addiction, and I'll never forget that one of the clients there pulled me after group and was like, "Tell me more about this, because I think you're totally, it's resonating with me, and nobody's talking about this." And this is like a young adult. So it was just then that I really started being interested in kind of the co-occurring nature of eating disorders and sex addiction, and knowing that Sophia had specialized in eating and sex addiction really has been fascinating to bridge these two worlds for me in particular.
Yeah, thanks for that, Caroline. Yeah, I think that this is going to be a really exciting time for us. Just as you were talking, I was really thinking about, I used to work with adolescents and children and families really specifically, and now I primarily work with adults, but I would imagine this is a really, really serious issue with young girls and young boys, and they, them, as far as, sexuality and how they feel about their body and what they're willing and not willing to do, to look a certain way. Because, not only are people looking at porn from a really young age, but people are taking pictures and sending nudes.
Yeah.
And so, I mean, that's a super common thing that people are doing. So, I think a lot of our conversation today, we had really planned to talk more about adults, but this is 100% an issue for children and adolescents. And I think that 100% will be working with adolescents in this area as well. Right
Yeah.
now, right now we're just focusing on adults, but this is a huge issue, I would imagine, for young people. Um, but yeah, so that's interesting that your client, that resonated with her. I hear this a lot from my male and female clients. People, typically are going to come to me for sex addiction, problematic sexual behaviors or sex therapy, but I hear a lot about food issues, binging or withholding is really huge. I think I probably hear more withholding of food, than I do of binging, but binging sometimes. But I know for my clients, and clients I've had in the past, I'm thinking of males and females right now with love addiction, specifically when love addiction for people is kicked up. There's a lot of withholding of food that I've experienced, but I would imagine it can definitely go the other way where there's a lot of binging as well. It just really depends on how people move through that anxious time. What are your thoughts around that?
Yeah, totally. I've seen it both ways as well. And I'm thinking in particular of a female love addict who really we were focusing on that first, and then we were just kind of going through like basic self-care, eating, sleeping, just kind of like the basics. And it came out that like I don't keep food at my house. Well, why not? Because if it's there, I'm going to binge. So but then there had been other times where there had been the withholding. And so I've seen it both, but I think it's definitely cyclical. And I think the interesting thing with both, which is kind of like the nuts and bolts of what we do in this work, is that, especially with eating disorders, I say to loved ones, to even to clients themselves, like it's not about the food, right? It's we've got to get deeper. It's a lack of getting those core emotional needs unmet. So whether it's I'm not going to eat, or I'm going to binge and purge, or I'm going to go exercise, or go watch porn, it all is some way of maladaptive coping to get something.
Yeah, 100%. Yeah, super unhelpful coping skills. And you're right that a lot of that is, it's learned behavior from what we did not get enough of when we were little. That care, comfort, safety, nurturing, and affection, that's really born in that original grief, neglect. Um, and when it comes to sex addiction, when I'm thinking of, again, from a lot of my clients, when people are really in their addiction, there is that tendency to be hyper focused about what other people look like and about what I look like.
Right.
And again, that's where I see a lot of that withholding of food and sort of the false thinking of, if I only look better, if I'm skinnier,
Hmm.
if I'm not so fat, just so much just self-hate you can hear in that,
Yeah.
um, then they will finally love me,
Mhm.
maybe then they'll like me. or
Yeah.
maybe then I'll be good enough. And that you can hear how tangled that is. It's so tangled.
Yeah.
And the sex and the food, they're both process addictions. So even though they're different addictions than alcohol or drugs, they're still addictions, the same presentation in the brain. So the brain doesn't know or care about the difference, if it's a process or chemical addiction. I mean, there are some differences, but we're just it's not pertinent to this conversation. So, the sex and the food, they get so tangled up. I mean, it's really a very tricky cycle that for me, what I've experienced, especially having you here at the practice, food and sex are specialties that, when I was a general therapist, there's no way,
Mm-hmm.
absolutely no way. And I was an excellent therapist. There's no way I could handle these two areas. It's very specialized. And then when we're talking even more about the tangling of the two, in the addiction neural pathway, this is really hard stuff to
Mm-hmm.
untangle and work through both, because both deserve recovery. Like it's a separate but similar recovery, but both are priorities in recovery.
Absolutely. Absolutely. And I think too, um, I think the treating both, right? It's not an either or. That intersectionality is so important. And I think, you know, we can also talk about the intersectionality of trauma, right? And how, and I've, some training places, it was like, well, we have to manage the eating and then we can deal with the trauma. And I'm like, no,
Yeah.
we've
Yeah.
got to do this together because it's all intertwined. It all works together.
Yeah, and I think that's so great. That thank goodness well, most of us are moving away from being trauma informed, which is really not that helpful as to like actually treating the trauma. And so,
Right, right.
yeah, because trauma informed just means I know a little bit about trauma.
Yeah,
That's not
yeah.
really not going to be terribly effective, at least in our field. Um, and absolutely. So, at this practice and the way that I do my work is, I want to get in there to what's earliest and worst
Mhm,
immediately.
mhm.
And because that's what's going to help and create a positive change in someone's addiction,
Right.
regardless if it's sex, food, or substances, it doesn't matter, or any other issue. We want to get in there and we want to go right into the trauma. We want to go right into the deep original attachment, grief, wounding.
Yeah,
We want to go into the hard places of suffering so that we can identify, decode, and deeply heal and reparent. And that's how we really are able to, you know, the terms I use with my clients are get better and feel better with
mhm.
our addictions. That's how we learn to live.
Yeah,
So yeah, we have to go into the trauma and the deep original grief. That's the pathway to being able to, um, live a quality life. And so that sex addiction, food issues, chemical addictions are sort of staying, they're living in the place in our life that they deserve to live, which is, a part of us, not the biggest part of us, but
mhm,
they're a part of us that
mhm.
that for me, I keep my addiction close to me because I don't want it coming and biting me in the butt when I'm not paying attention.
Yeah,
And so, but it's just not the biggest part of me anymore like it used to be. But
yeah,
you're right. I mean, going into the grief and the trauma is essential, 100%.
yeah.
And that's a big part of the workshops and intensives that Caroline and I are creating and planning that we're going to be doing online regularly. We'll have, a all female workshop, probably starting, in the next month or two, an all male workshop, and then we'll have some online intensives. And then of course people can travel here and do intensive work with us. I have people travel to work with me all the time to do deep original grief intensives. We We have a lovely hotel right across the street from our Durham office. And so and some great restaurants right here, like right in the parking lot where we are. So this is a great place to come and do intensive in-person work. Let's see, Caroline, anything else that you want to mention?
Um, I guess with what the intensives entail, and just I guess maybe kind of speaking a little bit about like interventions, like how do we do this work, and I think as a clinician here focusing on these different um addictions and disorders, I think I love using EMDR, which we've done podcasts on as well, some recent ones. And I think, you know, like you were saying, just that original grief, that aspect of it is huge. And um, yeah, I think just kind of being excited about this work. And I think too, one thing I want to always make sure that I'm um kind of instilling into folks is that recovery is possible,
Yeah.
right? And it's attainable. And I think sometimes that can get lost, right? Because it is overwhelming when we're talking about all of this. I mean, yes, is it hard work? Absolutely. Is it painful? And I think one of my biggest barriers that I run into is avoidance.
Mm.
And so if we can overcome avoidance, right, then we can face these things that are keeping us from getting better and feeling better. Um, so avoidance doesn't change anything. It just prolongs our distress. And so we have, a great team here I'm excited to be a part of, and that we're doing some really cool work. So, just kind of empowering people we can do this together, right? And that it's possible. And that avoidance it's not going to be helpful in
Yeah.
the long run to help you get to where you want to be.
I love that. And I'm big on helping people work through avoidance, and also always looking at my own avoidance, that I'm not aware of that pops up. And avoidance is a such an important um awareness piece for us. So I love that you brought that up. And yes, we do a lot of EMDR, we do a lot of somatic work, a lot of experiential work here. And I think you bring up a really good point. So for anyone who's listening who is scared to get into this, who is feeling like avoidant, sometimes individual therapy feels like the spotlight is on us, like that's scary for some people. Sometimes individual therapy is more calming and soothing because it's just me with one other person. But a workshop is a really great way to get introduced to these concepts. And so, in a workshop, how we do the work is it's different than therapy. So there is no spotlight on anybody. If someone wants to share what they just did in their 10-minute personal work, they're welcome to. If not, we just keep it rolling.
Yeah.
And a workshop is a great way to come in gently to some very deep work, because we can take it as deep as we want on our own after we learn the tools in a workshop. Like intensive work is great after a workshop. And so yeah, avoidance, that's a great thing to think about. And for people out there that struggle with that, showing up in a workshop, and our workshops, when we do special workshops, like my original grief workshops don't have more than 6 people, they're small. Sometimes when we do a workshop, there's like 100 people in there. That can feel a little, iffy to some people. But small individual, just very easy, flexible workshops are kind of what we put together here. Not everyone is appropriate for a workshop. We interview people. It needs to be a good fit. And but we have very relaxed we have a very relaxed space here, and also an online space that's very relaxed. So I love that you brought that up. Thanks for talking about that, Caroline.
Yeah.
Yeah, this recovery is definitely overwhelming, especially at the beginning. But when we do it together with people who know what they're doing, who are gentle and who, direct and challenge us when that needs to happen. Once we start feeling better, we're going to keep moving forward. And that's the key
Yeah.
is let's feel better quickly so that we can keep moving forward and get, deeply healed so that we can live the life that we all deserve to live. And yeah, I'm super grateful that we're going to be really focusing in this area. I'm so grateful that you're here and have this expertise. It's amazing. And we make an amazing team, and I'm just excited about all of this that we're going to be offering here very soon. So any last comments before we sign off?
Likewise, I'm grateful to be here as well and to be a part of this. And, I think just kind of touching on what you just said about the workshops too, like it's small and intimate. And I think a reminder that you're not alone, in this work. Because sometimes that can be a very common feeling is nobody gets it, nobody understands, but we get it and we understand. And it kind of helps build that little community of a support network and people that get it, and just that reminder, yeah, that you're not alone and you don't have to do this work alone. You're not meant to do this work alone.
Yeah, that's so true. We can't do recovery alone. It's just not possible.
Yeah.
Yeah. Okay, well, thanks, Caroline. I appreciate having this conversation with you. We're going to have many more podcasts about the sex and food issues and how they show up together. And
Yeah.
so please, stay tuned. Look at our website often to see when we're having offerings. And it was great having this conversation with you. Thanks for being here.
Yeah, absolutely. Thank you.
Bye.
Bye.